Prostate cancer, early symptoms that could cost you your life. Don't ignore them. Sometimes the most dangerous signs aren't the obvious ones. A little discomfort here, a subtle change there, and before you know it, it might be too late. Prostate cancer is a sneaky disease. It doesn't shout, it whispers, and if you're not paying attention, you might never hear it. But the body always gives warning. It sends silent alerts, early signs that most people ignore or mistake for something minor. In this video, you'll find out what to really watch for and why ignoring these signs can be a fatal mistake. Some of these symptoms might seem harmless, others are embarrassing, and one of them, especially, is the most dangerous of all. Do you really know what your body's trying to tell you? So pay close attention, because your health might depend on it. Number 12. Constant tiredness and unexplained weight loss. It's normal to feel tired after a tough day, but when that tiredness sticks around, even with enough rest, something might be wrong. Extreme fatigue and losing weight without a clear reason are silent signs that often go unnoticed but can be linked to advanced prostate cancer. These symptoms usually show up when the body is quietly fighting a tumor. They shouldn't be underestimated, especially if they come on suddenly and keep happening. Losing weight might seem like a good thing to some, but when it happens without changes in diet or exercise, it's a red flag. This could mean the body is burning more energy to deal with inflammation or a tumor inside. In prostate cancer cases, weight loss can be a response to tumor growth or even its spread to other organs. When the body gets out of balance like this, exhaustion is often the first visible symptom. Many men think fatigue is just from aging or daily stress and ignore it for months. But if the tiredness sticks around and comes with other signs like apathy, lack of motivation, or muscle weakness, it's time to check out. These could mean the body is seriously affected. Ignoring them can delay diagnosis and lower chances of effective treatment. It's also important to remember that cancer can mess with hormone production, which directly impacts energy and mood. Plus, inflammation from the tumor can speed up metabolism, making the body burn more calories even at rest. This high energy use can cause weight loss and worsen chronic tiredness. So listening to your body is a crucial act of self-care. If you've been feeling constantly wiped out for no clear reason and your clothes are getting looser or your appetite's dropping, it's really important to see a doctor. Catching any changes early can mean the difference between a simple treatment and a long, tough battle. Don't fall into the trap of thinking it's just stress or getting older. Often, your body talks before other symptoms show up. Persistent tiredness and unexplained weight loss should be seen as red flags. They don't confirm prostate cancer by themselves, but together with other symptoms, they can point to something serious. Ignoring them can cost you valuable time. The best move is always to get checked and have medical tests done to keep your health safe. Number 11. Involuntary urine leakage. Involuntary urine leakage can be embarrassing for many men, but should never be ignored. Often linked to aging or neurological issues, urinary incontinence can also be a warning sign for prostate cancer, especially if it comes on suddenly. It happens when the tumor starts messing with the pelvic floor muscles or the nerves controlling the bladder. This can show up in different ways like constant dripping, feeling an urgent need to pee but not being able to hold it, or having frequent leaks during everyday things like laughing, coughing, or standing up. Losing control of your bladder affects not just your quality of life, but your emotional well-being too, causing social isolation and low self-esteem. The psychological impact can be huge if it's not dealt with properly and quickly. When incontinence is caused by a prostate tumor, it usually gets worse over time. The tumor grows and puts pressure on important parts of the urinary system, making it even harder to hold urine. That's why any sign of incontinence, even if small or occasional, needs to be taken seriously and talked over with a healthcare professional. Early diagnosis can prevent bigger problems and allow for more effective treatments. Lots of men stay silent about this because of shame or fear, but it's important to realize that urinary incontinence can be one of the first symptoms of something much more serious. Ignoring it just lets the problem get worse. Getting a proper diagnosis can avoid many consequences way beyond physical discomfort. Nowadays, there are many treatments that can help restore bladder control, from pelvic physiotherapy to surgery. But all of that depends on catching it early and diagnosing correctly. Waiting until symptoms get worse is a common but dangerous mistake. Watching your body and acting early is one of the most powerful ways to take care of yourself. And remember, in this video, we'll reveal the most dangerous symptom of all, the one that, when it shows up, can mean the situation is really serious. Don't miss the last chapter. It could change everything. Number 10. Trouble starting or stopping the urine flow. Difficulty starting or stopping urine flow is one of the classic symptoms linked to prostate changes. Many men notice they have to push to start peeing, or that the stream is weak and starts and stops. While this might seem like a small annoyance at first, it can be the first sign of a bigger problem developing inside. This often happens because the prostate is growing and squeezing the urethra, making it harder for urine to pass. In prostate cancer cases, this pressure can be even worse because the gland hardens and grows uncontrollably. When this trouble becomes frequent, it stops being a minor issue and becomes a warning. The longer you ignore it, the more likely things will get worse. Also, feeling like your bladder never fully empties after peeing is another concerning sign. This can lead to urinary infections, stones, or bladder malfunction. What starts as a slight delay in starting to pee can turn into a bunch of urological problems that affect overall health and even safety. People often blame these symptoms on just getting older, which makes many men skip getting help. But that's dangerous because it hides serious conditions like cancer. Time is key with tumors. The sooner you diagnose, the better the chances of beating it. If you notice this kind of change, act fast. See a doctor and get tests to check your prostate health. A simple digital rectal exam, blood tests, and imaging can clear things up quickly. Prevention here is literally life-saving. But watch out, there's still more coming. And the most important part will be revealed in the final chapter, the most dangerous symptom that needs serious and immediate attention. You don't want to miss it. Number 09. Feeling pressure or heaviness in the bladder or rectum. Feeling constant pressure or heaviness around your bladder or rectum might seem temporary or unimportant, but this is one of the least talked about yet most important symptoms when it comes to prostate cancer. As the prostate grows, especially if there's a tumor, it can start pressing on nearby parts. That causes ongoing discomfort many men mistake for gas, constipation, or just stomach upset. This symptom is especially dangerous because people tend to ignore it or treat it wrongly for months. It's easy to think the heaviness is from bad eating, sitting too much, or an intestinal problem. But if it keeps coming or gets worse, it could mean a tumor is growing and taking up space in critical pelvic areas. The pressure might get worse when you pee, after sitting for a long time, or during bowel movements. In advanced stages, there might be pain during sex or even during simple daily movements. These signs show something is messing with the normal pelvic anatomy, and that something could be cancer. Also, remember the rectum and bladder sit very close to the prostate, so any size or shape change in this gland can cause symptoms in nearby parts. That heaviness feeling might be your body warning you that something is pressing inside that shouldn't be there. Unfortunately, this is an easy symptom to downplay. Many men just put up with the discomfort and hope it goes away on its own, but waiting can cost a lot. Tumors causing this kind of pressure might already be in advanced stages. Be alert. Your body's signals are clear if you learn to listen. And remember, the most dangerous symptom is still to come, the one that could mean the difference between early treatment and a fight for your life. Stick with us till the end. Number 08. Erectile dysfunction or sudden loss of libido. Erectile dysfunction and sudden loss of sex drive hit right at men's confidence and quality of life. But these symptoms can be more than just emotional or relationship issues. They might point to a deeper problem, like prostate cancer. Changes in sexual function should be taken seriously, especially when they happen out of the blue and without a clear cause. When prostate cancer is around, it can directly affect the nerves and blood vessels responsible for erections. Plus, hormone changes like a drop in testosterone might also be caused by the tumor. These things combined can seriously mess with sexual function. Many men wait to get help because they're embarrassed, but ignoring it can cost dearly. Another important thing, losing libido isn't just psychological. It might be a sign of a more complex inflammatory process happening in the body. Cancer messes with hormonal balance, causing disruptions that directly impact sexual desire. So when your sex drive suddenly disappears, it's worth checking out. Fear of diagnosis or the digital rectal exam keeps many men away from doctors. But this taboo needs to be broken. A healthy sex life is a sign of overall well-being, and ignoring problems here might mean missing early signs of a serious disease. Early treatment of prostate cancer can even save sexual function, which shows why paying attention from the start is so important. There are many treatments now for erectile dysfunction, but the best approach is to figure out what's causing it first. If it's a tumor, the focus should be on removing the disease. Sexual health reflects overall health, and taking care of it means taking care of your life. Heads up, the most dangerous sign of all is still coming. The last chapter will reveal the symptom that shows the cancer is at a very advanced stage. You need to know it. Keep watching. Number 07. Pain in the pelvic area or lower back. Persistent pain in the pelvic area or lower back often gets ignored. After all, who hasn't had back pain after a hard day or bad posture? But when this pain sticks around and doesn't get better with rest or normal painkillers, it's time to look deeper. For prostate cancer, this kind of pain can mean the tumor is spreading to nearby areas. This pain is usually described as deep, annoying, and constant. It might spread to hips, legs, or even upper thighs. When prostate cancer advances, it can hit bones and nerves in the pelvis, causing intense pain. Sometimes this pain shows up even before urinary problems, so it's easy to mistake for muscle or bone issues. Another thing, besides mechanical pain, the tumor can cause inflammation around tissues, making the pain even worse. This can mess with sleep, limit movement, and seriously reduce quality of life. If pain lasts for weeks and doesn't respond to usual treatments, it's a red flag. Ignoring chronic pelvic pain is common but risky. Many men just take painkillers without seeing a doctor to find the real cause. This delay is dangerous because it lets the disease get worse. The sooner the pain is understood and treated, the better the chances for a good outcome. Pain is the body's way of saying something's wrong. If it's persistent in one spot and won't go away with simple treatments, it deserves extra attention. If you have family history of prostate cancer or other symptoms, don't wait. Take this pain seriously. It could be a sign of something much worse. Number 06. Painful ejaculation or discomfort during ejaculation. Pain during ejaculation is something few men talk about, but can be a serious warning sign. Even though it's uncomfortable, this symptom is often ignored or blamed on temporary causes like stress or muscle tension. But if the pain sticks around or gets worse, you have to think about possible prostate issues, including inflammation or tumors. The prostate is directly involved in semen production. If there's a tumor, it can cause blockages or inflammation that make ejaculation painful. This pain can range from a mild burning feeling to intense pain lasting several minutes after sex. This kind of discomfort isn't normal and should always be checked by a doctor. Besides pain, some men also feel pressure or burning during climax. These signs come from inflammation caused by prostate changes, and sometimes there's blood in the semen or changes in its texture. Ignoring these signs can delay diagnosis and reduce chances for effective treatment. This symptom often comes with other prostate dysfunction signs, like trouble urinating or pelvic pain. That makes it even more important to get a full medical check, not just treat the pain with quick fixes. Finding the cause is key to fixing the problem for good. Fear or shame about talking to a doctor is a big barrier, but remember, sexual health is part of overall health. Your body sends signals, and when they're clear and repeat, it means something serious might be happening. No room for taboos when your life is at stake. And stay tuned. The last chapter will reveal the most dangerous symptom, the one that could mean things are critical. Don't go away. What's next is vital for your health. Number 05. Blood in the semen. Seeing blood in your semen can be shocking, and rightly so. This symptom, called hematospermia, is often ignored or thought to be caused by something minor. But if it happens repeatedly or with other signs, it could clearly point to serious prostate issues, including cancer. Even small amounts of blood need quick medical attention. Semen passes through the prostate before ejaculation, and any problem in the gland can affect its makeup. Tumors, inflammation, or blood vessel damage inside or near the prostate or seminal ducts can cause tiny blood vessels to break, making blood show up. This shows as red or brown color in the semen, which should never be normal. It's important to say blood in semen rarely causes pain, so many men don't worry or just wait for it to go away. But this attitude can delay a crucial diagnosis. The earlier a tumor is found, the better the chances for effective treatment with fewer impacts on life quality. Also, this symptom can be the only visible sign of an internal problem. Many early prostate tumors don't cause pain or urinary issues, making hematospermia one of the few possible clues. So any change in color, texture, or blood in semen needs to be told to your doctor. Getting tests like PSA and transrectal ultrasound can clarify the cause and avoid complications. It's not just about sexual function, but about overall health. The body warns you when something's wrong. Your job is to listen seriously. And heads up, the most dangerous symptom will be revealed in the last chapter. It could mean a point of no return. Keep watching this video to protect your life. Number 04. Blood in the urine. Blood in the urine is a warning sign that can't be ignored for any reason. Even small amounts visible or found in lab tests mean something abnormal is going on in the urinary tract. For prostate cancer, hematuria might mean the tumor is affecting nearby structures like the urethra or bladder. This symptom can show as pink, red, or even brown urine. Sometimes it comes with clots, which can cause pain or trouble peeing. But sometimes it's painless, making people ignore how serious it is. The truth is any blood in urine needs immediate checking. When a tumor grows inside the prostate, it can break tiny blood vessels. That lets blood mix with urine as it passes through the urinary system. In advanced stages, hematuria can become frequent and heavy, showing the disease has spread beyond the prostate gland. It's essential to get medical help at the first sign. Urine tests, PSA, ultrasound, and sometimes cystoscopy are good tools to find the bleeding source. Speedy diagnosis can stop serious diseases from getting worse and save lives. Ignoring blood in urine is a common but dangerous mistake. There's nothing normal about peeing colored urine. If it happens to you or someone close, get help fast. Health can't wait, especially when the symptom might mean a growing tumor. Number 03. Pain or burning when peeing. Pain or burning during urination is something many people think is just from urinary infections or spicy food like too much pepper or coffee. But if it happens often or gets strong, it might hide serious problems, including prostate cancer. The urethra goes through the prostate, so any change in the gland can affect the urinary channel directly. For prostate cancer, pain when peeing usually happens when the tumor squeezes the urethra or causes inflammation nearby. This pressure messes with urine flow and makes peeing burn. Plus, the tumor can lead to secondary infections, making symptoms worse. This burning can be a mild annoyance or intense pain, and often comes with urgency, weak flow, or needing to pee often. When these show up together, it clearly means something's wrong in the urinary system and needs full medical checkup. Waiting for it to go away can be risky. Men with this symptom often take painkillers or anti-inflammatories without finding out the real cause, just hiding the problem. It's crucial to understand pain is the body's defense, a call for attention. Knowing what causes it helps you act right and avoid future trouble. Simple tests like PSA, urine analysis, and ultrasound can help find if the problem is in the prostate or elsewhere in the urinary tract. The important thing is not to ignore signs or delay seeking help. Every day counts for early diagnosis. And remember, the most serious symptom will be revealed in the last chapter. It might mean the disease is in a critical stage. Don't miss it. Your life might depend on it. Number 02. Needing to pee frequently, especially at night. Getting up several times at night to pee might just seem annoying and part of getting older, but this habit, called nocturia, can be a serious warning sign for prostate cancer. When the prostate gets bigger, whether from benign growth or a tumor, it squeezes the urethra and stops the bladder from emptying fully. This squeeze causes urine to stay behind, making the body send signals to pee more often, even at night. And besides messing with sleep and life quality, this symptom can be the first hint of a silent prostate change. That's why nocturia shouldn't be ignored, especially if it starts suddenly or gets worse. Another point is that broken sleep caused by these frequent bathroom trips affects immunity, mood, and thinking. So beyond the pee problem, you end up with chronic tiredness and worse daily performance. All this should be a big red flag to get checked out. Keep in mind, not all nocturia is from cancer. Diabetes and infections can cause it too. But in men over 50, prostate risk always needs to be considered. So it's wise to get regular preventive tests and tell your doctor about any changes in peeing habits. Proper checkups are simple: blood tests, digital rectal exam, and ultrasound. Finding a tumor early lets you treat it better with less impact on life quality. The mistake is thinking this symptom is normal for age. That's a dangerous myth. Now, we're at the most important part of this video. The next chapter reveals the most dangerous symptom of all, the one that demands immediate attention and action. Stay tuned. It's why many men lose the chance to fight in time. Number 01. Trouble urinating. Out of all the warning signs for prostate cancer, trouble urinating might be the worst and most worrying, not just because it happens a lot, but because of what it means. When a man starts having trouble peeing, with weak flow, stopping and starting, or feeling like he can't fully empty his bladder, it could mean the prostate is growing out of control. This urethra blockage caused by prostate growth is like a strangling of the urine exit. In cancer cases, this growth is usually more aggressive and firm, pressing hard on the urethra and stopping smooth flow. Plus, trying to pee can cause pain, tiredness, and even small internal injuries over time. What makes this symptom so dangerous is it often appears when the tumor is already in a middle or advanced stage. Trouble urinating that keeps getting worse means the cancer has not only grown but is messing with basic urinary function. When this happens, the risk of complications like urinary infections, sudden urine retention, and kidney damage goes way up. Many men get used to this symptom for years, thinking it's just aging. Others take temporary meds like diuretics or anti-inflammatories without checking what's really wrong. And meanwhile, the cancer keeps growing. When they finally get help, the situation can be much harder to treat. This is the symptom that deserves the most respect, the signal that should never be ignored. Trouble urinating is the ultimate warning that the body is fighting an internal barrier, and that barrier could be an aggressive tumor. Once you spot this sign, the smartest move is to act fast, get tests, and see a specialist. Ignoring this symptom can literally cost you your life. So don't wait. Your health, your future, and your life are at stake. Time can be your best friend or your worst enemy. And to keep getting the best videos for your health and well-being, subscribe to the channel. It's here for one simple reason: to help you become a stronger, happier person. And the video that's popping up on your screen now reveals the leaf that naturally cleans excess sugar from your blood and beats diabetes. To watch that video, just click on the screen. See you in the next video.